My name is Dr. Lisa Park. I'm a professor at Columbia University. I'm also a volunteer doctor with Vision Care, and I sit on the ASCRS International Foundation Committee. And I'm so delighted to invite members of the committee here to share with you some of the work that we do and some advice and wisdom and hopefully pearls that we can share about participating in surgical missions. So I'm going to start by giving an overview of the problem and what is the scope of what we're doing? If we talk about global health, we're talking about the health of populations in a global context that transcends the perspectives and concerns of individual nations. It's been defined as the area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. In 2000, the United Nations Millennium Summit had 169 countries that signed a declaration to eradicate poverty, and they set the Millennium Development Goals. These were 8 goals with measurable targets and clear deadlines to improve lives of the world's poorest population. And you can see here that there are 8 goals, including eradicating poverty, universal education, promoting gender equality, reducing child mortality, improving maternal fetal health, combating HIV and AIDS, ensuring environmental sustainability, and global partnership for development. As you can see from these 8, 3 of them are health goals. And then in 2015, they refined these goals to come up with what are called the Sustainable Development Goals. So what happened in the years from 2000 to 2015? We saw great improvement in overall health, and that is a decline in maternal mortality, a significant decline in the under 5 mortality rate, and a significant decline in incidence of infectious diseases such as HIV, malaria, and TB. And why did we see this? We saw this because there was a significant partnership and a call to action for these particular diseases. So what is this in the context then of eye health? If we look at the numbers of people now that are living with certain infectious diseases around the world, people living with HIV is 36.7 million, people with TB 10.4 million, and malaria in malaria-prone parts of the world, 200 million people, but 429,000 people die from malaria. Now let's look at the numbers of visually impaired. Around the world, 285 million people are visually impaired. 246 million people have low vision, and 39 million people are blind. So the numbers are staggering. And 90% of people who are visually impaired live in low and middle income countries, and you can see that they're primarily in Africa and Asia. And when we talk about these 285 million people, 90% living in the developing world, and 80% of them are reversible. So what are the causes of visual impairment? The vast majority of them are cataract and refractive error. So refractive error 42% and cataract a third, 33%. So let's talk about then what has been the world and the World Health Organization response to this. If you look at the World Health Organization, it was founded in 1948, but there were no specific activities in blindness prevention. And in the 1950s, trachoma was felt to be the first blinding disease that attracted the WHO's attention. In the 1960s to 1970s, it became clear that there were other important causes of blindness, such as nutritional causes and parasitic blindness in Western African countries. It was in 1978 the International Agency for the Prevention of Blindness held its first General Assembly, and in 1989 they held a symposium on cataract blindness. In 1999, Vision 2020, The Right to Sight, was a global initiative for the elimination of avoidable blindness that was launched as a joint program between the WHO and the International Agency for the Prevention of Blindness. So this correlates approximately with the development of phacoemulsification. And what were the goals? This was a global cooperative action for reducing the causes of avoidable blindness by half by the year 2020. In 2013, the WHO met and revised these goals and came up with a global action plan, a 5-year plan that was unanimously adopted at this time. And what were the 3 things that they were looking to do? They were looking to develop specifically a sustainable and strong equitable eye health system by A, collecting data on the causes of blindness around the world, B, by training eye doctors and eye care providers in all capacities, and C, by making eye health part of comprehensive health, so including this in overall global health issues. And there are 3 specific target indicators that are being used now or have been set forth to measure progress in this arena. Number 1 is to document the prevalence and causes of visual impairment. Number 2, to document what are the numbers of eye care personnel. And number 3, to document and improve the cataract surgical rate and coverage. And coverage meaning that number of individuals with bilateral cataracts causing visual impairment who have received cataract surgery in one or both eyes. As many of us know in the mission field, because the incidence of blindness is so large that often we are operating on one eye only. But we know that although the vast majority of people who are blind are among the elderly, that the impact of cataract blindness affects all generations. And this is data from the Fred Hollows Foundation, which shows what are the benefits, the financial impact of preventing this type of blindness. And worldwide, the impact would be $517 billion. And that is the ability of people to go to work, the ability of their carers to go to school, and the prevention of injuries and falls due to blindness. And so we also know that any investment that's made has a very strong return, and the calculations around the world is that for every dollar that's invested into eye care specifically and preventing blindness, we'll have a 4-fold return on investment. So what can you do and what are we doing? The ASCRS Foundation the International Foundation is dedicated to improving world's vision. So what is being done, or what are the mission and objectives? Number 1 is to provide free humanitarian cataract surgery to those most in need, both in the United States and in the developing world. Number 2, to increase the capacity of physicians to treat cataracts through training, education, and through resources and support. And number 3, to promote innovation and new treatments by funding and conducting research. In 2004, the International Foundation sponsored the building of the Ocinski Eye Institute in Addis, Ababa, where they are now employ, I think, 12 staff members and are performing 22,000 surgeries a year. And ASCRS is also involved in partnerships with multiple organizations dedicated to the same goals. And this is one organization that I'm involved with that you'll hear a little bit more about, and that's Vision Care. And one of the primary missions is education, so teaching the doctors in their native countries and giving them the resources and support necessary for them to sustain their own eye health care system. And another part of what we do is to network and to enjoy the company of those who share the same vision and the same missions. And this is just a photograph from last night, a nice dinner that we shared with some of the Ethiopian trainers that we brought here to this meeting to participate in the educational objectives here. So I invite you today to join us in the conversation. I'm very delighted to have a number of very dedicated colleagues and faculty. We'll hear from Susan McDonald about safety and health concerns while traveling overseas, from Stan Pletcher about equipment and supply issues, from Dr. David Chang. He's going to present video about SICS for the phacosurgeon. Dr. Dong-Hae Kim is going to talk about his model for sustainable eye care in over 30 countries around the world. And Dr. Scott Lawrence will be sharing about glaucoma in the developing world.